This is Kathy Knipfer, instructor for Nursing 2333, recording the Managing Nursing Care lecture for Chapter 20 entitled Managing Quality and Risk. Managing quality and risk requires a comprehensive, systematic approach to prevent errors before they occur, also to identify and correct errors. As a result of that, adverse events are decreased, and safety and quality outcomes are maximized. This comprehensive approach also optimizes patient outcomes, prevents patient care problems, and mitigates adverse events. Standards of quality care include Nurse Practice Acts, accreditation standards, such as the Joint Commission National Patient Safety Goals, governmental bodies, such as the Agency for Healthcare Research and Quality, the AHRQ, the National Quality Forum, or the NQF, the National Institute for Occupational Safety and Health, NIOSH. It could also be healthcare advisory groups, such as the Institute of Medicine or the IOM. All these provide standards of quality care. Other sources that establish these standards of quality care include internal or external performance measurements, such as patient satisfaction surveys, employee opinion surveys, safety assessment surveys, and patient rounds. Also, another source would be institutional guidelines, such as policies and procedures and structure and process standards. Another source would be research and evidence-based practice guidelines. Another source would be the nationally recognized professional organizations. Some of the quality management terms include continuous quality improvement, or CQI, total quality management, also called TQM, quality improvement, or QI, and quality assurance, or QA. Principles of quality management include involvement, where leaders, followers, and managers must be committed to QI. There's a goal, which is to improve the system, not to assign blame. Customers define the quality. Factors should be measured that are most important to customers. The focus is on outcomes, and decisions must be based on data. Total quality management may look at structure, process, and outcome. For structure, the team would look at facilities, equipment such as unit-based medication delivery systems, staff adequacy, finances. For process, they would look at the nurse's role or evidence-based practice, such as timeliness of charting and adherence to critical pathways. For outcome, they would look at patient satisfaction, number of patient falls, maybe hospital-acquired infection rates. Let's look at a comparison of QA and QI. QA stands for quality assurance and QI stands for quality improvement. The goal of QA is to improve quality. The QI process also has the same goal of improving quality. The focus of the QA process is to discover and correct errors. The focus of the QI process is to prevent errors. The major tasks of the QA process are to inspect nurse activities and perform chart audits. For the QI process, the major tasks are to review nurse activities, provide innovation, and staff development. The quality team for the QA process includes QA personnel or department personnel. For the QI process, the quality team consists of interprofessional team members. Outcomes for the QA process are set by the QA team with input from staff. Outcomes for the QI process are set by the QI team with input from staff as well as patients. Steps in the QI process include identifying needs, assembling interprofessional teams, collecting data, establishing outcomes and quality indicators, selecting and implementing a plan, and then lastly, evaluation. The National Patient Safety Goals of the Joint Commission have consistently addressed accuracy of patient identification, effectiveness of interdisciplinary communication, safety of medication, reduced hospital-acquired infections, and identification of specific safety risks such as suicide and falls. Roles and responsibilities of the QI plan. On page 365, you will see the role of the senior leader, the nurse manager, and the roles of the followers. You should be able to summarize these roles. So now let's look at a case study. A significant increase in patient falls resulting in injury has been reported on your unit. In accordance with the National Patient Safety Goals, you are assigned to an interprofessional quality improvement risk management team to address the problem. You will use the steps in the risk management process to define the high-risk situation, which is patient falls, collect data, including frequency of falls, intervene and investigate, and then identify opportunities to improve care. And you will use the steps of the QI process, and those steps are listed on a previous slide. The first thing you would do is identify needs. You would assess compliance with the National Patient Safety Goals. You would look at hospital risk, financial loss. You would think about things like reducing the length of stay after an adverse fall event. You would establish outcomes. They should be measurable patient care outcomes or nursing sensitive outcomes. These nursing sensitive indicators reflect the structure, process, and outcomes of nursing care. Next, you would assemble an interprofessional team. This should include nurses, physicians, unlicensed assistive personnel or UAPs, or nurse aides, pharmacists, facility and environmental management representatives, and also QI risk management experts. Then you would collect data. You would define the incidence of falls. You would benchmark using the National Database of the Nursing Quality Indicators, or NDNQI. Through this process, using benchmarking, you would compare the best practices with your practice and process. You would determine high-risk patients based on age, mental status, history of falls, medications, and the physical environment. Next, you would identify outcomes and indicators. One outcome might be education of 100% of all direct care providers on the best practices. Another might be completion of a fall risk assessment on 100% of patients. Another might be a reduction in patient falls by 25% within 3 months of the program. Another might be a medical record audit that demonstrates 100% compliance with the fall prevention program that's developed. The next step for the case study would be to establish the fall prevention plan. This might involve consistent use of special ID bracelets based on the fall risk assessment score. It might include implementation of bed alarms, staff education such as toileting at-risk patients routinely. It might involve changing the environment such as vertical grab bars. You would then evaluate change. You would look at a change in the incidence of falls. You could look at incident reports and sentinel event monitoring. You could do root cause analyses. You would evaluate staff compliance with the fall prevention plan. You would assess patient and family satisfaction with the plan. And then you would also check the reliability and validity of the fall risk assessment tool. Next, you would want to ensure that the plan follows and is consistent with the standards of care for fall prevention. It needs to be consistent with nurse practice acts, professional organization guidelines, institutional guidelines such as policies and procedures, and structure and process standards. It should be consistent with research and evidence-based practice guidelines. It should also be consistent with accreditation standards, such as the Joint Commission and the National Patient Safety Goals. I would like for you to answer the following questions just in your own mind. How can a staff nurse make effective suggestions to improve nursing practice? How can a culture of assigning blame for errors be transformed into an environment invested in improving patient care? How can patients' expectations be used to improve nursing care and promote optimal outcomes?